what message would you offer African regulatory leaders who are really working very hard to strengthen their systems of quality and safety? Because there's quite a lot of hard work going on across the continent, which is very encouraging for us, patients who take medicines. But yeah.
Again, I really acknowledge the great progress that has been made, and I have been observing it over the past years in the different roles that I had myself. My messages would be to first of all.
Welcome to Utano Podcast. Let's talk about health in Africa, the podcast where we tackle tough health questions from an African perspective. Today, we are looking at how one of Europe's most influential institutions helps to ensure that medicines that people rely on every day are safe, effective, and of consistent quality, and what lessons that experience holds for Africa's rapidly evolving regulatory landscape. I am delighted to be joined by Dr. Petra Dörr, the Director of the European Directorate for the Quality of Medicines and Healthcare, or the EDQM, an organization that quietly but critically underpins Europe's medicines systems. Dr. Dörr, welcome and thank you for joining us today.
Thank you for having me. Thanks.
So to start us off, many of our listeners may not be familiar with the EDQM, what it is and what you do. Could you briefly explain what the EDQM does and how it fits into Europe's broader effort to ensure that medicines are safe and they're effective?
Yeah, thanks. I'm happy to do that. The European Directorate for the Quality of Medicines and Healthcare, or EDQM for short, is part of the Council of Europe and plays a central role in protecting public health across Europe and beyond. And in brief, it sets legally binding standards for the quality of medicines and their ingredients through the European Pharmacopoeia, and therefore ensuring consistency, purity, and reliability of medicines. It provides official reference standards used by manufacturers and control laboratories to verify compliance with these standards. It also coordinates a network of official medicines control laboratories, or OMCLs, for independent quality checks, and it issues certificates of suitability, or CEPs, to ensure the ingredients of medicines meet the requirements defined in the European Pharmacopoeia. And it also develops guidance for the safe use of medicines, its traceability, and strategies to prevent falsification. And it also coordinates with the European Union and international bodies on broader health initiatives, including substances of human origin and sustainability in pharmaceutical practices. It supports regulatory systems and harmonization by working with global partners, like, for example, the Pharmacopoeia Discussion Group or the World Health Organization, to align standards and reduce duplication. So you mentioned it, quality, safety, and efficacy. These are the three pillars of medicine regulation. Quality ensures medicines meet strict standards for identity, purity, and consistency. Safety protects patients from unacceptable risks. And efficacy guarantees therapeutic benefit. And together, they underpin regulatory approval, global harmonization, and public trust, ensuring that every medicine is reliable, effective, and safe for use. So the EDQM focuses on setting quality standards and ensuring the safety of medicines. And it has always served also as a global catalyst for international cooperation and collaboration, with the aim of advancing the quality and safety of medicines and other health products globally. And this, we're doing it by engaging with an international community of stakeholders across the public health landscape, by fostering partnerships and networks, and building a bridge between regulatory and operational realms, ensuring the alignment between standards and practices, all for the benefit of patients and consumers. So at the EDQM, we embrace a culture of collaboration, not only with our 39 member states and 33 observer states, but also with those who implement and apply the outcome of our work, like healthcare professionals, academia, manufacturers, and patients. Because ultimately, patients benefit from safe and good quality medicines provided to them through the collaborative efforts with our stakeholders.
Yeah, so a lot. It sounds like you're really the glue that's holding everything together, making sure it works efficiently across all of the European member states. And I wonder if it would be correct to say that whilst patients may never see the EDQM's work directly, it really shapes almost every aspect of the medicines they use from the raw materials to the final products. And that brings us to how all of this fits into the wider European regulatory system. What I have understood about keeping patients safe is that it's about building a quality ecosystem. The EDQM and the European Medicines Agency are obviously working side by side with very distinct but complementary roles. How does this ecosystem that you have built work together to protect patients from the lab to the bedside?
Yeah, thanks for highlighting this element of cooperation and also mentioning already the complementarity. This is a critically important attribute of the work the EDQM and the European Medicines Agency do. So the EDQM, in short, is responsible for setting the quality baseline through the European Pharmacopoeia standards, where we define the legally binding quality specifications for medicines and ingredients. Through reference standards and certification, where we supply official reference substances and issue the certificates of suitability, which confirm compliance with pharmacopoeia standards and which are critical for global supply chains. And we also provide the safety and traceability guidelines, as I mentioned already, where we develop best practice guides for hospital traceability and falsification prevention, reducing medication errors and safeguarding patients. On the other side, the European Medicines Agency main responsibility is regulatory oversight and market access by doing the scientific evaluation authorization of medicines, testing assuring the quality, safety, and efficacy, and issuing recommendations for EU-wide marketing authorization, which is ultimately granted by the EU Commission. And then they also are responsible for pharmacovigilance and life cycle monitoring, where they oversee post-market safety, they manage shortages, and coordinate responses to emerging risks like antimicrobial resistance. And they also work on patient-centric reforms, where they drive initiatives for faster access or digital product information and environmental sustainability in medicine regulation. So as you said, the mandates of EDQM and the EMA are complementary, and through cooperation, we ensure the effective use of our respective resources. We provide the technical compass, the standards, the reference materials, and the safety guidance, while EMA ensures the regulatory oversight and patient access. And this synergy, if you can say, guarantees that medicines reaching the patients are of high quality, safe, and effective, and therefore also reinforcing the trust from the lab to the bedside.
Yeah, so in essence, really a system of interlocking responsibilities, that are complementary, that are not duplicating what the other does, and it's all deliberately designed to work in this way. I'm curious, Dr. Dörr, why, if you could just explain, just for our viewers and for my understanding also, why the EU system saw it fit to have a separate, to have two separate agencies dealing with, setting the standards and the guidelines, and then the other implementing, the oversight function and the approvals and so forth. What is the rationale? Just, if you could just quickly touch upon that.
Mm-hmm. I think it's as often it's a historical element that shaped the landscape of regulation of medicines in Europe, and we also need to acknowledge that the European Medicines Agency is an agency of the European Union, whereas the EDQM is part of the Council of Europe, which is a body that is older than the European Union, is focusing on human rights, democracy, and the rule of law, and has 46 member states. So membership going far beyond the membership of the European Union.
Yes.
The European Pharmacopoeia was established more than 60 years ago, and EU pharmaceutical legislation followed after in the 70s and already built the foundation of the European legislation, the EU legislation, incorporating the existing European Pharmacopoeia as an element. And this is how the history started and how it evolved then, with increased cooperation between the European Union and the EDQM, with the European Medicines and the EU Commission as partners, and with extended and expanded cooperation in the last 15 years, not only focusing on medicines regulation, but also more importantly on substances of human origin, where there is a very close and fruitful cooperation also between the EU Commission and the EDQM.
Yes, so it's
a joint evolution, let's say, of both institutions and a building on existing foundations, which was the European Pharmacopoeia at the time.
Okay, so is it really the fact that you are part of or you're an institution that is part of the European Parliament that gives you the ability to issue guidelines and standards that are legally binding because you're part of the legislative framework?
The European Parliament, the EU Parliament is a body of the European Union again. And the Council of Europe is distinct, is not to be confused with the European Union. And I know it's difficult even for European citizens, and it is almost intransparent and not understandable for people outside of Europe. But the Council of Europe and the EDQM, especially the work that we do, is founded on the European Pharmacopoeia Convention. And this is what I mentioned, is the basis of the work of the EDQM, the basis of the European Pharmacopoeia, and it's a legally binding treaty. And by acceding to the European Pharmacopoeia Convention, the countries commit to implement those guidelines, those standards.
That's clear.
On a legally binding basis. So there's not, it's not like a guideline, which is optional for implementation. It's a best practice, but the European Pharmacopoeia contains legally binding standards.
Sure. No, that's very clear. Yes, I mean, if Europeans themselves don't understand it, what chance have we to understand how all of this works? But I think I got it now. So let's continue. Now, there's a powerful phrase that really summarizes the philosophy of, of a lot of what you do, which I really like, that quality and safety don't happen by chance. What does that mean in practical terms for you sitting at EDQM in terms of, how it applies in practice for regulators, for manufacturers, and for patients?
Yeah, so indeed, the phrase quality and safety does not happen by chance. It means that medicines and other health products cannot simply be assumed to be safe and effective. They require a deliberate, systematic controls at every stage of their life cycle. And different stakeholders have different roles to play, as you mentioned, regulators. Here, one element is risk-based oversight and inspections, where regulatory authorities enforce good manufacturing practices and conduct routine and for-cause inspections to verify compliance. They also issue standards. They rely, for example, on the pharmacopoeia standards and other international norms to ensure consistency and reduce variability across borders. And then they are also responsible for continuous vigilance, post-market surveillance, and pharmacovigilance. Their systems monitor adverse events and enforce corrective actions, ensuring safety beyond initial approval. For manufacturers, their responsibility is to embed GMP, the good manufacturing practices, and quality systems. They also need to implement design and process controls, and ensure global compliance to, for example, harmonized standards, which reduce duplication, but also demand rigorous adherence to evolving requirements. And for patients, ultimately, it is trust that is built on transparency, because patients expect medicines to be safe, effective, and of consistent quality. And the trust depends on robust regulatory frameworks and manufacturers' commitment to quality. And finally, the access to reliable products for patients requires a strong quality and safety system which prevents shortages, falsification, and variability, so that patients can be ensured to receive the right treatment at the right time. So overall, quality and safety are the result of intentional design, strict standards, and continuous oversight, not luck. So regulators enforce the rules, manufacturers operationalize them, and patients benefit from a system that prioritizes risk management and transparency at every step.
So much that I believe our own systems here on the African continent could really learn from, putting it all together. And what really comes across as you speak is the idea, the intentionality of how this system has been designed, from setting the standards and making sure that those standards are implemented. Because oftentimes, countries can have beautiful laid out standards, but if they're not implemented, they don't serve their purpose. So that idea of intention, designing quality rather than reacting to failure, seems to me to be one of Europe's greatest strengths in how you have put this together.
Yes, indeed. Yeah.
Yes. So now, Europe's success in maintaining medicine's quality, as you have already explained, is built on collaboration and standardization. What key design principles makes this system resilient and possibly transferable to other regions like our Africa region or elsewhere around the world?
Yeah, so Europe's resilience in safeguarding medicine quality is rooted in, as you said, a few key design principles that other regions may adopt. First of all, there's a common legislation in the European Union, as well as legally binding standards, which provide, like a harmonized, enforceable basis for medicines across member states. There's also multi-level collaboration between the different players, EDQM, the European Medicines Agency, but also, very importantly, the national competent authorities and industry, which ensures the alignment from standard setting to regulatory oversight. And then there's also the players in the European regulatory environment. They participate actively in global harmonization initiatives such as ICH or PDG, which means that European standards are interoperable internationally, which reduces duplication and facilitates global supply chains. And maybe one last element I'd like to mention is the integrated risk management, where quality and safety are embedded through good manufacturing practices, pharmacovigilance, and post-market surveillance systems. And the continuous monitoring and rapid corrective actions make the system adaptive to emerging risks. So these are not all, but some of the key factors that ensure this resilience in safeguarding medicine's quality in Europe, but also globally, I guess.
Yes. I mean, you mentioned interoperability. That's a big challenge for us, because across countries we have a mishmash of systems of things that are happening that I think somehow bringing it all together is probably going to be one of the key challenges that we face, so that we have a system that can communicate with each other, especially when it comes to minimizing harm and communicating risk sharing, risk reduction, as you just explained. Now, let's talk about innovation and ethics. Emerging technologies like artificial intelligence and digital tools are really shaping and changing regulation everywhere. Talk to me about how the EDQM is embracing these innovations whilst keeping ethics and evidence at the heart of decision making to keep patients safe.
Yeah. So within the EDQM, we are exploring the opportunities provided by AI, and this is part of our medium-term strategy, and it's part of a wider strategic objective to continuously modernize our working methods to increase the quality and efficiency of our contribution to public health. EDQM is integrating AI and digital tools through a governance-driven, ethically anchored and evidence-based approach, ensuring innovation enhances regulatory efficiency without compromising trust or scientific rigor. If I may just add a few words on the work that the Council of Europe does with regards to ethical standards and artificial intelligence. There is a steering committee for human rights in the field of biomedicines and health. And its mandate is to safeguard human rights and dignity in biomedicine and health through legal standards, ethical guidance, and intergovernmental cooperation. And the second element is that the Council of Europe, its framework convention on artificial intelligence and human rights, democracy and the rule of law, is the first ever international legally binding treaty in this field. And it opened for signature just last year on the 5th of September. It aims to ensure that activities within the life cycle of AI systems are fully consistent with human rights, democracy, and the rule of law, while being conducive to technological progress and innovation. So both the Council of Europe and the EDQM embrace innovation and technology while maintaining ethical standards and upholding human rights to safeguard people.
Yes, it's very remarkable how human rights seems to really underpin everything and a lot of the work and really serves as a guiding star to what's being done and how it's being done. Now, let's talk about solidarity and perhaps lessons that our systems here on the African continent could take from the work that you do. One of the most urgent global challenges that we face, particularly here on the African continent, but one that every country around the world, I believe, faces as well, is the spread of falsified substandard medicines. And I was just actually looking at the data yesterday, how when the WHO issues these alerts, you see that the highest number of alerts are coming from Europe. But what really is striking is that Europe does very well at preventing these products entering their markets in the first place, something that we are not doing so well on the African continent. What lessons from Europe's coordinated approach to tackling or preventing this risk, this challenge to patient safety, could you share with us that might help our regulators to strengthen their own system and the way they're looking at this?
Yeah, I think Europe's success mainly rests on, again, the common legal framework like the EU Falsified Medicines Directive and also the Council of Europe's Medicrime Convention, which criminalizes the activities connected with the falsification of medical products.
Yes.
It's also embracing the technology like unique identifiers and anti-tampering devices. Another important element is effective market surveillance and control of supply chains, combined with rapid alert systems and databases accelerating information sharing. But I'd really like to stress that tackling the risk posed by falsified medicines and related crimes requires multilateral cooperation across nations, disciplines, and sectors. And this lays the ground for cooperation with and between international bodies such as Interpol, UNODC, the World Customs Organization, the World Health Organization, in order to put a stop to this international threat to public health. It is really a global problem requiring a global response.
Yes, a complex one at that, a very complex one that requires so many pieces, so many disciplines to come together and be able to work effectively alongside each other in order to be able to bring those protections. And it seems that for Europe, the fact that you have legislation that underpins this across member states and of course working alongside surveillance and that effective cooperation, these are really critical elements to being effective at protecting patients from these dangerous products. Now, Africa's regulatory landscape is evolving with many countries, making a lot of progress. We've seen a number of countries achieve maturity level 3 this year on the WHO benchmark. And of course, our African Medicines Agency is operational. It's well on its way. How can collaboration with the EDQM accelerate Africa, our journey, the journey of our regulatory agencies towards maturity, towards systems that really, truly protect patients from dangerous products like substandard medicines and of course, that are trusted by people?
Yeah, allow me first to also acknowledge the great progress that has been made at a national and a continental level in Africa. So as you mentioned, the WHO benchmarking, it's now a total of 9 African countries that have achieved this maturity level 3 for medicines and or vaccines. And that maturity level 3 is defined by WHO as a stable, well-functioning and integrated regulatory system. Yes. And I would also like to take this opportunity to congratulate Dr. Delese Mimidako on her appointment as the Director General of the African Medicines Agency. For the EDQM, we have been contributing to regulatory system strengthening in Africa for a number of years, and we have also joined the World Health Organization's coalition of interested parties, which has been established to better coordinate support in regulatory system strengthening. And more recently, we have engaged in a major EU-backed initiative under the European Commission's Team Europe framework in partnership with the European Medicines Agency to strengthen regulatory systems in Africa. And we are doing this by focusing on 2 strategic priorities. First, building capacity in the African Medicines Quality Forum, AMQF, and its networks of African reliance laboratories. This to foster collaboration and reliance models that should help improve efficiency and save cost. And secondly, it's about enhancing national quality control laboratories and helping them to establish and maintain state-of-the-art quality systems and testing competencies aligned with international best practices. We feel that we are a good partner in these 2 objectives because we really bring decades of experience in managing the general European OMCL network, which can serve as a model for independent quality control and underpins the trust in Europe's medicines. And the expertise is now being shared to operationalize the African Medicines Agency and the African laboratory infrastructure and create a harmonized and resilient regulatory framework. Go ahead. Yeah, just to summarize, I think our involvement reflects our commitment to regulatory excellence beyond Europe. And with this collaboration, we want to accelerate progress with shared standards, shared expertise, and shared responsibility.
Yes, and I guess, that collaboration is critical because no system exists in a silo. I suppose And, if risks are circulating in any part of the world, it really touches us all wherever we are. And I guess so there is an important aspect of, of that collaboration that protects people at home and abroad, I presume. Now, from your perspective, what are the most important ingredients for building trust between regulators, manufacturers, patients in any system, whether in Africa or in Europe?
I guess there are many ingredients, but let me just mention 4 that I find quite important. First of all, it's transparency. So there's a need for clear standards and open communication among all stakeholders. And then there's the element of accountability with independent oversight and enforcement. The element of engagement with the need to involve stakeholders in the work and also in awareness campaigns.
Yes.
There is the element of consistency, finally, which looks at harmonized rules to reduce uncertainty and risk. So as I said, these are maybe, for me, the main ingredients to maintain and build and maintain trust. But there may be a few other ones that could be mentioned here.
Very powerful ones. Transparency, having standards to guide what is done, accountability and engagement. Those really are very, very important ones indeed. Now, as we begin to wrap up, I would like to zoom out a little. If you could share one design principle that you say, what, every health regulator in the world should adopt this one, what would it be?
Yeah, here maybe I should start with a disclaimer, because this is a quite personal viewpoint. Yes. And it's rooted in my personal history, because I've always been involved in international collaboration activities and different organizations, lately in the World Health Organization, now in the EDQM. And for me, collaboration is one of the design principles that is kind of intrinsic in the system and that we need to embrace and adopt. And if I may mention a second one, and that's reliance, because we came to the conclusion that no regulator, no country can do it alone. And sharing the expertise and also sharing the data accelerates access without compromising the safety of medicines.
Yes.
So reliance and collaboration for me are the one design principle, maybe the 2.
Yes. No, that's really very good ones. We had Dr. Martin Harvey Oldchurch on the podcast, and he talked about similar things as well. And the way he put it is that no single regulator can tackle the challenges, the extent of the challenges that regulators face worldwide by themselves. And for sure, collaboration and reliance is really one way to overcome that. Now, finally, what message would you offer African health leaders, African regulatory leaders who are really working very hard to strengthen their systems of quality and safety, because there's quite a lot of hard work going on across the continent, which is very encouraging for us, patients who take medicines. But what message would you leave them with?
Yeah. Again, I really acknowledge the great progress that has been made, and I have been observing it over the past years in the different roles that I had myself. My messages would be to, first of all, embrace harmonization, collaboration, and reliance, the 2 elements that I just mentioned. Maybe to learn from the mistakes and also the experiences others have already made, to use the resources wisely where they add most value in protecting the health of patients, and to invest in regulatory systems, in capacity, in capabilities, and also infrastructure, because in the end, quality and safety do not happen by chance, and they do not come for free.
Wonderful. So embrace collaboration, invest, and design safety into your systems because they will not happen by themselves. Dr. Petra Dörr, thank you so much for sharing your insights and for reminding us that quality and safety really are something that has to be deliberately designed and that you need collaboration and cooperation in order to make it work as an effective tool of protecting patient safety anywhere in the world. For our listeners, whether you're in Europe or here in Africa or anywhere else around the world, the message from Dr. Dörr is clear. Strong regulatory systems are the foundation for confidence, for safe access to medical products, and for better health outcomes when patients receive care. Thank you so much, Dr. Dörr, for coming onto the podcast today.
Thank you so much for inviting me, giving me the possibility to speak here.